Hello everyone, in this video we will be seeing bronchial asthma, causes of bronchial asthma and drugs used to treat the bronchial asthma. The word asthma means difficulty in breathing. Bronchial asthma is chronic inflammation of airways. Cells that causes inflammation of airways by releasing inflammatory mediators are mast cells, eosinophilic and T lymphocytes. Bronchial asthma is type 1 hypersensitivity reaction, and it is characterized by formation of IgE antibody, which causes release of histamines and leukotrienes from mast cells. This histamine and leukotrienes causes bronchoconstriction and inflammation of the airways, and this inflammation causes hypersensitivity. Drugs classification. They are mainly classified into 5 types. First one is bronchodilators. As there is bronchoconstriction, we will be giving this drug to dilate. Second one is leukotriene antagonist. As there is release of leukotrienes, we will be giving this drug. Third one is mast cell stabilizers. Whenever mast cells bind with IgE antibody, they cause degranulation and produce histamines and leukotrienes, which will cause bronchoconstriction and inflammation of the airways. So this drug is given to stabilize the mast cell. Fourth one is corticosteroids. They are anti-inflammatory drugs. They are given to get relief from inflammation. Fifth one is anti-IgE antibody. They are given to decrease the production of IgE antibody, hence to relieve from type 1 hypersensitivity reaction. Bronchodilators are again divided into B2 sympathomimetics, methylxanthines and anticholinergics. In B2 sympathomimetics there are 2 drugs, salbutamol and formoterol. In methylxanthines there are 2 drugs, theophylline and aminophylline. Anticholinergics, in that there are 2 drugs, ipratropium and tiotropium bromide. Leukotriene antagonist, in that there are 2 drugs, montelukast and sulfileucast. Mast cell stabilizers are sodium chromoglycate and ketotifen. Corticosteroids are divided into 2, systemic and inhalational. Systemic include glucocorticoids. Inhalational include dipropionate and propionate. Anti-IgE antibody, in that omalizumab. Mechanism of action of the sympathomimetics. Stimulation of B2 receptor will increase the production of CAMP, and this will cause relaxation. CAMP in mast cells and other inflammatory cells will decrease the release of inflammatory mediator. Side effects of sympathomimetic drugs are muscle tremor, restlessness, nervousness, throat irritation, ankle edema and hypokalemia. Mechanism of action of methylxanthines. It causes bronchodilation by 2 ways, block adenosine receptors and inhibits phosphodiesterase enzyme. High dose of methylxanthine cause release of calcium from sarcoplasmic reticulum in skeletal muscle and cardiac muscle. Side effects: headache, nervousness, nausea, gastric pain, rectal inflammation and pain at injection site. Uses: bronchial asthma and COPD. Anticholinergics will block M3 receptors. Mast cell stabilizers, in that sodium chromoglycate inhibits degranulation of mast cells. Side effect: bronchospasm, cough and throat irritation. Uses: bronchial asthma, allergic rhinitis, allergic conjunctivitis. Ketotifen, it will stimulate the immunogenic and inflammatory cells and reduce the release of inflammatory mediators. Side effect is sedation, dry mouth, dizziness, nausea and weight gain. Corticosteroids is not bronchodilators. It inhibits inflammatory cytokine production and eosinophilic lymphocytic infiltration of the lungs. It also reduces bronchial hyperactivity, mucosal edema and suppress inflammatory response. Side effects of corticosteroids are hoarseness of voice, dysphonia, sore throat, symptomatic or asymptomatic oropharyngeal candidiasis. Omalizumab, it neutralizes free IgE in circulation without activating mast cells and other inflammatory cells.